All right, let's talk about leukemia. It's this type of cancer that starts deep inside our own bodies, right in the little factories that make our blood. We're going to break it all down, what it is, how it works, and what the key clues are to really understanding it. So let's start our investigation.
So to really get a handle on this, I want you to picture your bone marrow. Think of it like this super advanced factory, just churning out all the essential parts of your blood 24/7. The whole point of this explainer is to answer one really big question. What on earth happens when that factory just goes completely haywire?
Okay, so first things first, we've got to identify the main players here. We'll start with what leukemia actually is, and then we'll get into its four main types, or its four phases.
So, at its heart, leukemia is basically a rebellion. It's like your body's cell making machinery goes rogue and just starts pumping out tons and tons of these abnormal, useless white blood cells. And these aren't the good guys, the ones that fight off infections. Nope. These are just dysfunctional clones that don't do their job, and they end up causing a whole lot of chaos. Now, here's the thing. Leukemia isn't just one disease. Not at all. Doctors actually break it down using two simple questions. First, how fast is it moving? If it's acute, that means it hits hard and fast. Chronic, on the other hand, is a much slower burn. The second question is which type of cell is the problem? And that's where you hear the words lymphoid and myeloid. Just think of them as the two main family trees for your white blood cells. Okay, so if you mix and match those two things, speed and cell type, you get the four main kinds of leukemia. You've got ALL, or acute lymphocytic leukemia. That's actually the most common cancer in kids. Then you have AML, acute myeloid leukemia, which you see more in adults. And this one has a very specific clue called an hour rod. We'll definitely circle back to that. Then you have the chronic types, CLL and CML. These usually show up in older adults, and like the name says, they move a lot slower. Oh, and pay attention to that last one, CML. It has a super specific link to something called the Philadelphia chromosome. Tuck that name away, it's important. All right, let's zoom in. We're going right inside the factory, deep inside the bone marrow, to see exactly how this hostile takeover goes down at the cellular level. It's a surprisingly simple but totally devastating three-step process. First, these immature cells, they're called blast cells. They just start multiplying like crazy with zero quality control. Then, step two, these rogue cells start to completely crowd out all the good, hard-working cells in the bone marrow. And finally, the whole factory gets so overrun with this junk that it just fails. It can't make the healthy red blood cells, white blood cells, or platelets that you absolutely need to live.
And this factory shutdown, it leads to what you could call a triple threat of consequences. Threat number one, you don't have enough working white blood cells. That's called neutropenia. This means your body can't fight anything off, so the risk of infection goes through the roof. Threat number two, not enough red blood cells, which is anemia. That's why people feel so incredibly tired and weak. And threat number three, a shortage of platelets. That's thrombocytopenia. Without them, your blood can't clot, which leads to all that uncontrolled bleeding and bruising.
Right? So all this chaos that's happening deep inside your bones, it doesn't stay a secret for long. The body starts sending out some serious warning signs. So for the next part of our investigation, we're going to learn how to read those clues. In these symptoms, they make perfect sense when you know what's going on inside. That constant deep bone pain, well, that's literally the bone marrow swelling up, trying to make space for all those rogue cells. And when you see swollen lymph nodes or an enlarged spleen or liver, that's because the cancer cells have spilled out of the factory and are now invading other parts of the body. And then you get what doctors call the B symptoms, that unexplained fever, the night sweats that soak through your clothes, and losing a lot of weight without trying. These are huge red flags that the body is in a major crisis. So when doctors start seeing these signs, they basically turn into medical detectives. Let's take a look at the tools they pull out of their toolkit to confirm what's going on and, crack the case. Now, a simple blood test can give some really strong clues. It can definitely point the investigators in the right direction. But it's not the final answer. To really, truly solve this mystery, there's one test that gives the absolute, undeniable proof. And here it is, the bone marrow biopsy. This is the absolute gold standard. They take a tiny sample right from the source, from the factory floor itself, and a pathologist can look at it under a microscope and literally see the takeover happening with their own eyes. This doesn't just tell them, yes, it's leukemia. It tells them exactly which kind it is. And this is where we find our first big piece of evidence. When the pathologist is looking at that marrow sample, if they see these funny little needle-shaped things inside the bad cells, those are called Auer rods. Finding those, it's like a detective finding a perfect fingerprint at a crime scene. It is a slam dunk diagnosis for acute myeloid leukemia, AML.
And here's clue number 2. Hey, remember I told you to keep that Philadelphia chromosome name in your back pocket? Well, here's why. It's a very specific genetic mistake. Basically, a piece of one chromosome breaks off and sticks to another one. And this unique marker is the dead giveaway for chronic myeloid leukemia, or CML. Finding this is the genetic smoking gun. Case closed. So, okay, the diagnosis is in. The case is solved. Now the fight really begins. So, let's talk about the absolute top priorities when it comes to managing a patient with leukemia. And this next point is maybe the single most important thing to understand about managing this disease. You see, while chemotherapy is obviously a huge part of the plan to kill the cancer cells, the thing that is most likely to kill the patient, especially early on, it's not actually the cancer, it's infection. Think about it. The bone marrow factory is down, which means the immune system is completely shot. A simple cold for you or me could be absolutely lethal for them.
Because that threat is so real, patients are put on something called neutropenic precautions. It's basically a protective bubble. It means everyone is washing their hands constantly. The patient is often kept in isolation, and you have to get rid of anything that could carry germs. So no fresh flowers, no raw fruits or vegetables. Every little detail matters. Even a tiny spike in their temperature is treated as a full-blown medical emergency. This quote right here just sums it all up perfectly. The fight against leukemia isn't just one battle. It's a war on two fronts. You're attacking the cancer cells with everything you've got, while at the exact same time, you're desperately trying to defend a person who has no immune system from a world full of germs. Okay, so let's wrap up our investigation. What are the big things to take away here? Number 1, the diagnosis isn't official until you have a bone marrow biopsy. Number 2, remember those clues. Our rods scream AML, and the Philadelphia chromosome points right to CML. Number 3, that triple threat, infection, anemia, and bleeding, that's what drives all the symptoms. And finally, don't forget that ALL is the most common cancer you'll see in kids. And that brings us to one last thought to chew on. You know, we've gone from these really broad categories to pinpointing a specific genetic mistake, like the Philadelphia chromosome. So as science gets even better at reading the tiny blueprint of ourselves, you have to wonder, how is that going to completely change the fight against leukemia in the next decade? Something to think about. Thanks so much for joining me for this explainer.